Hello, my name is Dr. Kathleen Puntillo, and I'm a faculty in the School of Nursing at the University of California, San Francisco. We want to tell you about an intervention for thirst for our ICU patients. But first, a little background. Patients in ICU experience many symptoms, and research has shown that thirst is one of the most pervasive, intense, and undertreated symptoms in these patients. Now, we routinely do mouth care for our ICU patients. However, the usual mouth care has not been shown to be effective for relieving thirst. The fact is that there are many biological, clinical, and treatment-related factors that can influence thirst. So thirst is not just about not being able to drink liquids. Let me introduce my colleague, Ann Lemus, who will tell you more about an intervention for thirst.
My name is Ann Leemhus. I'm a nurse in the Adult Medical Surgical Intensive Care Unit at UCSF Medical Center. The thirst intervention that we will be demonstrating to you has shown to be effective for patients who are able to drink fluids as well as those who are unable to do so. We would like to demonstrate how to do the thirst intervention so that you can provide the intervention to an ICU patient with thirst. We refer to the intervention as a bundle because it combines activities that together have relieved patients' thirst. We'll go through the thirst assessment and intervention step by step.
First, assess your patient's thirst by asking the patient, "Are you thirsty?" If a patient acknowledges thirst, you can show the patient an enlarged laminated card that contains these questions. If they have difficulty speaking, they may be able to point to the number that best captures the intensity of their thirst. If the patient seems unable to give a number to their thirst, you can use a different question. You can show them the card with these words, mild, moderate, severe, and provide them an opportunity to point to the appropriate word. You now know if your patient is a candidate for the thirst intervention, and you can explain to your thirsty patient that you can do something that might help to relieve some or all of their thirst. Gather the necessary materials. These include the following: a small spray bottle, a container of ice-cold sterile water, oral sponges or swabs, a cup that will be filled with ice, a tube of mentholated mouth moisturizer. There is spearmint in the moisturizer that you'll be using. Menthol is in the spearmint. It's important that it's mentholated since it's the menthol that stimulates cold receptors in the mouth, which in turn helps alleviate thirst.
Hey Justin. Hi there. I just wanted to ask, I know you mentioned that you were having some thirst. Would you be able to tell me on a scale of 0 to 10 how thirsty? 0 being no thirst and 10 being the worst possible thirst?
About a 9.
About a 9?
9.
Okay. Okay, so I have some ice water here and some stuff. Would it be okay if I swabbed your mouth to see if that helped with your thirst?
Yes.
Make sure that the water in the spray bottle and water in the cup are icy cold. The temperature of the water is important. Moisten the mouth swab and gently wipe the patient's mouth with the swab.
So we'll start by swabbing your mouth about 2 or 3 times. You can open your mouth for me, a little bigger, and I'm just going to swab around your tongue and the roof of your mouth here. Does that feel okay? Okay. I'll do that one more time. Okay, open your mouth for me again. Okay, a little bit on your lip here. Okay.
Ask the patient to open his or her mouth as wide as possible to receive the
then
sprays.
I was going to try to spray the back of your throat with some ice cold water. About 5 times, but we'll take a little break in between, okay?
Okay.
Okay, so if you could open your mouth nice and big, this is kind of what the spray looks like.
Point the spray tip towards the oropharynx and tongue and depress the plunger on the spray bottle to give up to 6 sprays with approximately 5 to 10 seconds between sprays.
Okay?
Mm-hmm.
All right. And we'll do one more kind of up. All right. Is it feeling any better so far?
It's still a little dry, but that's helping.
Okay. So we'll go ahead and do some more swabbing.
Cold water has been shown in research to relieve thirst better than body temperature water. Cold water may also cause more saliva production, which can help with mouth dryness.
One more swab and then we'll do some sprays.
Pause and repeat the sequence of 2 to 3 swabs and 5 to 6 sprays of water. Pause again and do this procedure a third time.
About 5 to 6 more sprays. 1, 2, 3, 4. Okay. Just give you a little break here, and then we'll do it one more time.
Okay.
You feeling okay?
Mm-hmm.
Not having any pain or anything?
No pain.
Okay.
Just thirsty.
Oh.
Yeah, it's helping.
Okay. And so then I have this little mouth moisturizer. It's kind of like a chapstick, but you can put it inside your mouth as well.
Okay.
And it's a little bit, it has a spearmint component that kind of helps with your mouth maybe not feeling so dry for a little longer. Would it be okay?
Yes.
All right, so I'll start by putting it on your lips and make sure you like it, okay?
Apply the mentholated moisturizer liberally to the patient's lips and tongue.
Okay, you can rub that in for me a little bit. Does that feel okay?
Mm-hmm.
Be okay if I put a little bit on your tongue?
Yes, please.
Okay. Alrighty. Is your mouth feeling a little bit better?
Yes.
Would you be able to tell me again, I have the numbers in front of you again from 0 to 10. 0 being no thirst and 10 being the worst possible thirst.
About a 3 now.
Okay, so maybe it helped a little bit?
Yes.
Okay.
After completing the procedure, reassess the patient's thirst by using the same process as earlier. And be sure to record the patient's thirst response now that he or she has received the intervention and complete the form. Repeat the thirst intervention if the patient has thirst at least one other time, that is, at least 2 times total, during your 12-hour shift, and complete the report forms each time. Remember, you can do the thirst intervention more often, but please fill out the assessment and intervention form each time that you do it. Now that we've demonstrated the thirst intervention, let's cover 8 key points. First, thirst is a prevalent and intense symptom in many ICU patients. Second, the thirst intervention that we have demonstrated has been shown in research to relieve ICU patients' thirst. Third, use icy cold water for the water sprays and mouth swabs. Remember that icy cold water satiates thirst more effectively than water at body temperature. And cold water offers greater relief from mouth dryness and stimulates salivation. Fourth, it's important to use a moisturizer that contains menthol. Menthol causes an increase in nerve discharge from cold receptors in the oropharynx, and this causes a cooling sensation. Fifth, the intervention should be done according to the standardized protocol. Sixth, even patients who can have fluids by mouth can have unquenched thirst and may benefit from the intervention. Seventh, patients who are NPO can get thirst relief because the relief does not necessarily depend on gastric distension from swallowed fluids. Thirst can be treated with water which is not swallowed because of the cold-sensitive receptors in the oropharynx. Eighth, mechanically ventilated patients can receive the thirst intervention as long as they're able to follow directions. We're not concerned about spraying water into the mouths of patients with ET tubes. Water has a pH of 7.0, does not obstruct the airway, can be absorbed by pores in the lungs through which water crosses membranes, and is taken into the blood vessels and carried to the bloodstream. Don't hesitate to contact us if you have any questions about the procedure. Finally, we hope that you will find satisfaction when providing comfort and care to your patients as they get relief from their thirst.